After someone is rescued from an overdose, the next most critical step in care is securing proper treatment as soon as possible.
So we have offices from Cherokee County all the way to Carteret County. We have outpatient clinics across the state. We have recovery housing. We have pharmacy services. And so we provide in our outpatient settings and our mobile units real wraparound care. So that means psychiatric med management, addiction treatment, and Suboxone or MAT, medication-assisted treatment or medication for OUD, opioid use disorder. But for a lot of rural and remote areas, we have mobile access, we have telehealth.
So you guys care for people who are struggling with addiction and may have suffered an overdose.
Addiction, overdose, mental health services as well. But when it comes to overdose, I think that's where the true risk for overdose death has been in North Carolina, is that somebody struggles from right after an overdose and there's not a seamless transition into care, or they get the wrong level of care. So they may be rescued by EMS workers, but they're given a referral to maybe a location that will see them in a couple of days, or only outpatient where they don't have a home themselves, or they're in an environment that's not conducive to abstinence. And so in a situation like that, no matter where they are in the state, we bring them to our inpatient facility here in Sea Level. We go through our crisis management and detox. And then they have the opportunity to stay with us in the residential treatment, where they can stay 30, 60, or 90 days. In residential, they'll be able to continue to stabilize, work on some drug-free coping strategies. But then we also have other types of things that they can work, art therapy, and enjoying some off time, enjoying some activities like fishing or seeing the various islands in the inner banks, as we call it. And then after residential treatment, they can stay with us in our peer-managed, treatment-focused recovery housing, which is all federal funded. We have about 120 some beds across North Carolina of free, federally funded recovery housing for men and women, where they can learn life skills, supportive employment, but mostly learn drug-free coping strategies with others who have lived experience. Recovery is not just a light switch that you turn off and on, and all of a sudden this brain disease is gone. So one of the things that is critical when they do survive an overdose, either they have rescue Narcan in their home, or they have somebody that has rescued them with that medication, or by EMS, they need to get immediate help with somebody in a detox or crisis management setting, because that's the greatest risk, honestly, of continuing to use because of withdrawal and cravings. And once they can get into a safe environment where they can detox safely, the next step is a smooth transition into the right level of care, maybe in an inpatient residential, if that's not a good fit because of their own life challenges at that time. That might be into partial hospitalization, where they come into a classroom setting 5 days a week, intensive outpatient, where it might be 3 days a week. Getting the medication that can really prevent craving and withdrawal, but marrying the addiction treatment side with the mental health side, with the social support from peer support specialists, that's where you get the real, I would say, bang for your buck, where you have a real wraparound program. Because a lot of people haven't had absence in their lives, not just years, but decades. We have people that are coming in at all ages, and sometimes they have been in active use for 30 or 40 years. So it's really changing people's lives.
To find more information about ICGH and Carolina Wellness Centers, you can call the numbers or visit the websites listed on your screen.